Good afternoon, everybody. This is Steve Wilson from the Illinois State Water Survey, and we're here today for a webinar on what water testing labs need to know about private wells. This is being co-hosted by us at the Water Survey with our private well class program with the Association of Public Health Laboratories. And I do want to mention a couple things about the funding for us and how this program came about. The private well class is funded through the Rural Community Assistance Partnership, RCAP, and US EPA. And we're also, RCAP is a partner on all the activities we do under the private well class program. Our webinars are available to environmental health professionals for continuing education credit. And so we put this slide up before each webinar. If you are an EHP, and NEHA credentials, have NEHA credentials. There are handouts in the GoToWebinar menu. As you look down your dashboard, you see attendees, polls, questions, handouts, chat. That's what I see anyway. And so we haven't done this webinar since July 19th of 2016, but a lot of the content will be the same. So if by chance your 2-year credentialing cycle ends this month or next month, then, and you were on this webinar before, then you can't use it for both, but that's very odd and narrow window of folks, I would imagine. If you have any questions about credit, or you want a copy of the slides at the end to use for submitting in your own state for whatever reason, you can email us at info@privatewellclass.org, and we will get back with you. So I did want to mention RCAP. This is a webinar for labs, so hopefully most of the folks on the call today are actually lab personnel. And this program is much more than our doing webinars and having an online class for well owners. We have an actually on the boots on the ground program through RCAP. They have staff in every state. You may work with them. It depends on which region of the country you're in. RCAP is the umbrella organization. It's in Washington for these 6 regional nonprofits. Out west, it's RCAC, the Rural Community Assistance Corporation. In the Northeast, it's RCAP Solutions. In the Mid-South, it's Communities Unlimited. So they're known by different names, but they're all under the RCAP umbrella. They have staff that are mostly technical assistance providers, and they're doing one-on-one work with well owners and also hosting workshops for well owners in many of the states in the country under this grant from EPA. So a little bit about us at the State Water Survey is really relevant here because the Water Survey started in 1895 because of typhoid and cholera outbreaks in the state. And so the building that this plaque is next to at the University of Illinois is Noyes Lab, which is a chemistry building here. And so the Water Survey has been around for over 100 years, and it's really interesting. We're just like a state geological survey, which almost every state has, but we deal with just water. And so I believe we're the only one in the country. There may be one in name in Oklahoma as well, but the Water Survey has collected data for over 100 years. We have a lot of information about the state of Illinois, and typically that is our kind of our bailiwick is to work with the citizens in the state of Illinois. I show this because right now we're going through all our old records and we're finding all this really crazy information about the historical work the Water Survey has done. This is from April and May of 1916, excuse me, where there was a typhoid fever outbreak in Pana, and how they figured out eventually that it was the ice cream parlor in Pana, the Pana Ice Cream Company, that was the source of the typhoid. And so this is just one example of, kind of the historical background of what we do. Today, we do a lot of applied research. We work with communities to help them with water quality and water quantity problems, and also work nationally for things like private well owners. We have a public service lab, which Dan Webb is on the call. He runs our lab until 2008. Any well owner in Illinois could get a free private well sample for Inorganics and Metals. And now there's a charge for that just because of the way our state budget's been. But it's really a great service for the citizens of Illinois. And, there's a lot of, like I said, we've been around a long time. So About today's webinar, it's part of this national program I've already mentioned through RCAP, and again we're hosting it with the Association of Public Health Labs. Sarah Wright's here today and she's going to present. It is being recorded, so it will be on our website and on YouTube under our YouTube page. I do have to mention, for the first time in probably 4 years, our website is down. We had a server issue yesterday, and they're working to fix it. Hopefully it'll be done by the end of the day today, but right now if you try to go to privatewellclass.org, it's just going to sit and spin, and I apologize for that. That's very rare at the university, but it's the case where we all have to deal with today. Katie Buckley's on the call too. She works with me here at the State Water Survey. She's going to take your questions. During the presentation today, if you have, whether I'm talking or Sarah Wright or Lou Barinelli, I'll introduce in a second, if something comes up and you want to ask a question, in your dashboard for GoToWebinar, there's a question and maybe a chat box. Katie's going to monitor both of those, and if you ask a question during the webinar, she's going to put those on the list. We'll pull it up at the end, and we'll go through them. And we're also doing an interactive thing today with you, especially for lab personnel. That's who this is really geared for. And I would ask if you're a well owner just to sit tight and watch during this part of the presentation. We're asking labs a couple questions, and you can use Google Docs to share one document. It's actually a really cool process. You can all be on there at once, and we can watch it unfold on the screen. And so if it turns out you're with an agency that won't allow you to get into Google Docs, I apologize, but you can watch like everyone else is, and then we would appreciate it if you'd email us answers to those questions if you're not able to do that today. And Katie will mention that whenever the time comes that we're going to do that, and the link to click on will be in your question box or your chat box. So with that, I'm going to get started. So yeah, this is what this looks like. What I'm talking about here. Go to the questions, and again, I have a chat box as well, and you can see handouts. This says 05. Over on the live screen, I've got 4 of 5. There's 4 documents there you can download, and I believe they're all PDFs. So, okay. So I'm Steve Wilson, as I mentioned. Sarah Wright's here from the Association of Public Health Labs. Lou Barinelli, who runs the lab with the New Hampshire Department of Health and Human Services, and Dan Webb, who I already mentioned, who runs our public service lab here at the State Water Survey. Dan's going to answer questions at the end that some of you may have, and yeah, I mean, we really run this together, so to speak, or the 3 of us do, Katie as well. What I'm going to talk to you about as lab personnel is some of the issues related to well owners. That's my expertise. I'm a groundwater hydrologist. When a well owner calls me, I help them understand their well or their geology or their water source. So what we're going to talk about today is really understanding well owners and the issues that are important to them as well as you as a lab facility. Sarah's going to talk about the lab survey they did last year on private wells and some of the findings from their members. And then Lou's going to talk about lab partnerships. And then I'll finish up talking about private well resources that we can provide you as a lab to give to your well owners when they ask questions. So, and then if you remember when you registered for this webinar, there was an opportunity for you to ask questions in advance. We've answered probably a dozen of those. There was a lot more than a dozen questions, but we'll go through those and talk about the answers we have for those. And then that's in addition to, if you have questions today, please put them in the question and chat box like I mentioned, and we'll get to those at the very end. So with that, I'm going to talk about well owners and what you kind of need to understand about them. The reason they're difficult to reach as someone who tries to reach out and educate well owners is they come from everywhere. They're rich, they're poor, they're educated, they're uneducated, they're from every social, economic, and education class. They're urban, they're rural. Some may have been on a well their entire life for the 4th generation. Others may have always lived in a city on community water supply, and they decided to buy a house out in the country, a nice colonial 3 miles out of town, and all of a sudden they've been thrown into this issue of not understanding what it means to be a well owner. So you could also grow up in a very rural area like I did. I grew up on a 14-foot hand-dug well that my grandpa hand-dug in 1933, which I'm going to show you in a second, or even a completely urban area. For those of you that don't know, The Chicago area, Cook County is really Chicago proper. It's it's along the lake, and all the surrounding counties around Cook County are also completely urban. You know, I want to say there's 7 or 8 million people there. So people in a really rural area like where I grew up have much different issues than someone who lives in a completely urban setting. And so just to demonstrate that, our State Geological Survey has this website where you can look at all the well logs. And you can see Chicago in the image on the left, and it says Cook County there right above Cicero. And if you go out a little bit to the left near DuPage and Lombard, that area is what I'm highlighting on the right. And when I pull up the wells, these are all the private wells that are there. Most people would assume that everybody in that urban area is on a community water supply. But what's happened is that all the municipal boundaries don't line up. There's all these little unincorporated areas where people have put in wells and have their own septic. And so there are actually 3,000 private wells in use in Cook County, which even when I say that to people who live in Illinois, they can't believe it. And it's not like these wells are really old and they were there a long time ago. This particular well that I highlighted was drilled in 1995. So, you know, it's still going on today. But those folks, the issues they have, you know, are road salt and contaminants from an urban setting. Those sorts of things are much different than like where I grew up. This is a picture from my backyard. That little building down at the bottom with the door on it, our 14-foot, 3-foot diameter hand-dug well sits inside of that. I show a map here of Middletown, Illinois, where I grew up, 1.5 miles out in the country. There's only 3 wells, and this is also an image from the Illinois State Geological Survey's water mapping tool, and you can see how few wells there are there. There's only 2 in the section, and I drew a not very round circle where my well is, which we don't even have records for, which is the other issue. Many times there aren't well records for older wells. Our issues were we had an ice storm. We didn't have power for 7 days. Electric pump doesn't work when you don't have power, right? Also, in the summer, because it's such a shallow well, we had livestock. If I left a hose in our horse tank, we might be without water for 2 or 3 days, and then the water was muddy, literally muddy. Or if we had a huge rainstorm, you can see how this is shaped going down to the well. You know, my grandpa put it in this low spot because he knew water would run there, not understanding that that means so does manure, so does, you know, chemicals, so does everything else from the surface. And when we have a really large rainstorm, our water would come out of our tap, you know, cloudy and muddy. And so not protective at all of surface contamination. So well owners, the bottom line here is you don't know. Every well is a little bit different. They're unique, and it's worth understanding what their situation is, how protected it is at the surface. The geology and all those things are all a component on whether their well might be contaminated or if it has more of a risk. So Barb Lukonen from, she was with the University of Minnesota Extension, she's retired now, did a survey where they sent out 2,700 questionnaires into 6 counties, 2 in each of Minnesota, Wisconsin, and Michigan. And so that you can see here, they sent out the ones in Wisconsin with $2 and a free test, the ones in Minnesota with a $2 bill, and the ones in Michigan with a coupon for a free test. And you can see the percentage at the bottom of that first table. More people responded when they got a free test and $2 versus those that you know, had fewer incentives, so to speak. But what's interesting about this is the questions they asked. They had 1,733 questionnaires returned, and over 1,100 of those have never sampled their well. So, you know, it's 2/3 basically. And when asked for those 2/3, were they very worried about possible health risks from their water, 87% said they were only slightly worried or not worried at all. And that's without any testing ever, that they, you know, they admitted they had not tested. So they gave them a laundry list of questions about why hadn't they tested, and this is the results. We've been drinking it for years. Half the people said that, and they could answer with more than one response. The one that really gets me, but I do understand, is I don't want to know. It's like going to the dentist. Sometimes you put it off. you don't really want to know what's going on. It might cost you a lot of money, or it might really hurt. The same way here. I actually had a well owner tell me that I was doing an arsenic study where we were looking at the variability of arsenic on a small scale. So we were in a rural subdivision that all had private wells. And in some cases, these wells were only 15 or 20 feet apart from one house to the next. And we asked, went up to these houses and said, can I sample your well? There's known arsenic in this aquifer. All your wells in this aquifer, blah, blah, blah. And had one person who said, you can sample my well as long as you don't send me the results and you do it when I'm not home. And so after digging a little bit and talking to the guy, it turns out he's trying to sell his house. And in Illinois, there's a legal form you have to fill out where it's a questionnaire when you're selling a property. If you have a well, it asks you, do you know of anything adverse with your water quality or septic? And he wanted to be able to honestly answer that question, no. And so he did not want me to send him the results. So, there's a lot of things that you wouldn't consider when you're working with well owners in their situation, but it comes right down to property values in some cases. So, again, there were about 1,100 respondents. I went through this, but they really come down to a series of reasons. I don't know what to test for. I don't know how to test. I don't know. I didn't know I should test. To me, those are knowledge barriers, or what we call knowledge barriers. That's on us as professionals. If a well owner in our area doesn't know that they need to test, then we've done something wrong, because we should be getting that message out there. Versus, it's probably fine, I don't want to know. They don't understand what the risk really is, and so that's a different type of situation where the messaging has to be different. And so why this is important for you as a lab professional is, there's a lot of issues that well owners just don't understand. There's actually a lot of people who probably should not be private well owners. They haven't done their due diligence to understand what it means. They're basically the steward of a private well, which makes them a water operator for a very small water system. And it's their responsibility to make sure that their water's safe for their family, and a lot of them just don't understand that. And so that's our job, and that's my job, is to work with well owners and try to help them understand those things. So why are they contacting you as a lab? For testing, clearly, but there's a lot of reasons. Just a general concern, maybe it's a property transfer and they have to, someone got sick. A lot of things these days are media induced. I guarantee you, every time that there's a new thing in the news, like a Flint, Michigan, or the PFAS thing that's going on now, we see people testing more or wanting to find out more information. The number of phone calls we get go up. Even we've had water operators tell us that whenever they have a boil order because they've had a main break on a community water supply, that some of the residents that live in the surrounding area out in the country will want to get their water tested or call them to find out if it means that their well water isn't safe, not understanding that it has nothing to do with their well. So again, it's a lot of issues that are in the news, so to speak. There's droughts, the floods last year in Florida and Texas, fracking issues, and then it was lead, and now it's PFAS. And I guess I've already mentioned that. But it really comes down to most wells, it's because of poor construction and just lack of well owner knowledge and education. Well owners really don't understand all the issues related to their wells. You need to have a little bit of a geologist in you and a little bit of a public health person, a lot of different things you need to know to really understand a mechanical background if you're going to try to fix things yourself. And so some people are well prepared for that, but most aren't. And what it comes down to is a lot of wells don't meet current construction code, like both of these don't. They've got a wood cover over their well. Snakes, rats, anything else can get in that well. And here's one of our staff sampling it to see what might be in there. But it's poor construction, and when the rules were changed and when well construction codes have been modified over the years in different states, older wells are grandfathered in. They don't have to meet construction code. So if it's already there, that's where a lot of these issues are. We've run across, our RCAP certainly has run across wells that are well over 100 years old and still in use. And that's where we're at. So your client may have no idea what they need to test for or why, and or in other cases they may give you an exact list. They've done their research, but you need to be prepared to help them do that. Yeah, they might need or they might need it as a means to an end, like they're selling their house. They just wanted some justification that it's safe. What ends up happening there that's a problem is sometimes they don't sample for the right things and don't really realize that they might be having a problem. So the bottom line is they are relying on you. And so as a lab, you need to be able to tell them what to sample for, explain why, and provide the details and understand your area. And I know that means more effort as a lab, but one of the things that Barb Lukonen did with her study, Minnesota did a follow-up on about 750 wells that they did sample that had high arsenic. And one of the things they learned is that the number one place that well owners go to for information is their local or state health department. The number two place they go to is a lab. So a lot of well owners are counting on labs to be able to provide that information. So yeah. And I need to get through my piece here. So also understand that well owners will ask for and need assistance, as I mentioned. You know, if you know of contamination sources, somebody should be versed in those things. The area you're in, if you live in Pennsylvania, for instance, Pennsylvania has no well construction code and they don't license drillers. It's one of only 2 states that don't do those things now. But that means you can have a lot more variability in well construction, which means probably have more wells that may not be safe and protective at the surface. So the other piece of that is then know who the right people to talk to are, your state geological survey, your U.S. Geo survey, as well as whatever agency does manage any kind of well issues. Like in Wisconsin, that's DNR. In Illinois, it's IDPH. It just a few phone calls and you can find out a lot of information. So just to be able to point them to resources is a big issue and very helpful. And the rest of this is my opinion. I'm a groundwater hydrologist, as I mentioned, and what I do is educate well owners. And I've also sampled probably 1,000 wells in my career. Been here way too long, 30 years. But what I think a lab should be able to do is provide guidance to the well owner on what to sample for, provide good instructions on how to sample and when they need to be to the lab, as well as be able to give them local contacts for health, extension, other agencies that can give them information about their geology or the aquifer they might be tapped into, and then where they can get their results reviewed by a health professional. When a well owner has a sample back from a lab, you know, a lot of times it's kind of Greek to them what all that means, and knowing where to go or what kind of information is available to interpret what's on those sample results is really critical. And lastly, we've put together for well owners what we think well owners should sample for, and it really does depend to some degree on where you're at in the country because there are various contaminants that can be different, but we recommend sampling for coliform and nitrate annually. Because they're an indicator of a pathway into your well, and that means your well's not safe, and other things can get in your well from the surface. So you should always ask or have them ask the county or state health department for advice, and they should be investigative, and so should you. You know, Massachusetts has this website where you can type in an address. It will tell you if you need to be concerned about arsenic or uranium. Rhode Island has this map. The little dots are all where there used to be orchards, and they know there's arsenic contamination in soil that can eventually get into groundwater, and the big splotch in the middle is beryllium. Beryllium's not very common. Until I saw this map, I didn't realize that beryllium was even a regulated contaminant by the EPA for a community water supply, but it is, and if you live in this area and it has health effects, you know, you maybe should sample for beryllium, which is a really kind of unique thing to me. Here's what we recommend. You should sample annually for coliform and nitrate. Again, they're a pathway. They indicate a pathway into your well. And then here's a small set of constituents that kind of give you a good basis for the general chemistry or groundwater chemistry of your well, as well as if you have copper pipes or you have galvanized piping, then or lead piping, clearly, which we recommend lead regardless because of solder and other issues. And then go to your health department and ask if there's anything else you should be concerned with. And again, that's just what we tell well owners. Everyone has their own opinion on this, and yeah, we'll talk about some of that later. So that's my intro into all of this, if you will. I'm going to turn this over to Sarah from the Association of Public Health Labs. And yeah, Sarah, thanks for joining us.
Thanks, Steve. Can everybody hear me?
I can hear you. I can't see your slide.
Okay, I'm going to show my screen.
Yeah.
Let's see here. Okay. Do the slideshow option. And it's coming.
There you go. Well, yeah.
There we go. Can you see that?
Yeah, no, what we're seeing is what you see, which is the notes on the side too.
Oh, okay. Okay, let me change that. Shoot, let's see here. Sorry about that. Does that work?
That's better. There you go.
Great. Okay, thanks, Steve. All right, well, good afternoon, everybody. I'm Sarah Wright with the Association of Public Health Laboratories, and Steve and I were talking a little over a year ago about what we could do for their National Private Well Water Conference. We thought, well, it'd be great to get a survey and see what the labs do across the country as far as their capabilities and capacities, and that's what created this presentation. We also presented this last year at the National Private Well Water Stakeholder Conference, and then wanted to get the message out to a broader audience as well. So today I will go through who is APHL and what do we do, what was our private well water survey method, what were our private well water survey results, and what were the general takeaways and next steps. So who is APHL and what do we do? Okay, so we are located in Silver Spring, Maryland. The picture that you see here, that building is located in Salt Lake City, Utah. That's the Utah Public Health Laboratory. And they're one of the 54 state and territorial public health laboratories that make up our membership, in addition to about 10 environmental laboratories, 10 agricultural laboratories, and maybe 55 or so local public health laboratories at the city or county level. The Association of Public Health Laboratories, we work to strengthen the public health laboratory system through convening, training, communications, and advocacy. I specifically work with the environmental laboratories and trying to strengthen that system. So those could be the environmental laboratories either at the public health laboratory or maybe the standalone environmental laboratory at each state or the one at the city or county public health laboratory. Regardless, we consider all those environmental laboratories, and they test air, water, and soil potentially, and then within that, private well water. So that's how we got to today. So what was our private well water survey method? So back in February 2017, we started the survey development in collaboration with 3 member laboratories and Steve, no last name needed here. We had 12 questions, but they were expanded and, kind of really 24. So it's tricky, but we pulled it off on people. We developed the survey tool through Qualtrics, which is a great survey tool system. And then by the time we got it developed around April 11th of 2017, we sent it out to 37 state public health or environmental laboratories. The next day, we sent it out to the APHL local lab director listserv, and about a month later, we closed the survey. Here's the shot of the opening survey page, just for your viewing. We redacted the information because the survey was supposed to be anonymous, but whenever I do mention specific labs throughout the results, I did talk to them beforehand to get their permission. So what were the results? So out of all those surveys, we had 26 state laboratories that completed it and 14 local laboratories. And which ones actually accept private well water samples from the general public? So that meant that they needed to complete the rest of the survey. So states accept, it was 18 states that accepted private well water samples and 8 local public health laboratories. And then which ones accept the unregulated drinking water samples from outside of the lab's jurisdiction? You can see that all the locals did, but only half the states did, and that was likely because of geography and distance reasons. So looking at the survey results further, we wanted to determine how many private well water samples does each lab analyze annually. You can see that the red bars represent the local laboratory results, and the orange bars represent the state laboratory results. We had 3 different main ranges that those results fell into. So for the states, we had 7 states that would analyze between 10 and 2,000 samples a year, 9 that would analyze between 3,000 and 8,000 a year, and 2 that were kind of outliers that analyzed between 20,000 and 50,000 samples a year. Those were Maine and Wisconsin. with the local laboratories, we had 3 local laboratories that would analyze between 60 and 100 samples per year. A bump up to the next group, 3 between 900 to 1650 per year, and then finally again 2 outliers analyzing between 3,000 and 4,000 samples per year. And those are typically the local labs that were outside the bigger metropolitan areas, similar to what Steve was saying about Cook County. So we were curious what other types of drinking water sample sources that the labs were collecting and analyzing from the general public. So this could have been cisterns, ponds, or springs. And we have a little less than half of each of the lab groups that did analyze for something other than private well water. 3 of the states analyzed for all 3 of those categories, and then just some of the other interesting drinking water sample sources otherwise. We had some where the labs would collect samples, take samples from the public that had surface water as their drinking water, and then also a few that would do their own home test on what the public water system was delivering as far as the water to their house. So these results could be a little bit unrepresented, though, because sometimes the labs, they don't necessarily know where the drinking water sample came from, just that it's labeled as drinking water and that it's from the general public. So what do they provide? I'm not sure if that's on the screen or not, but so what do the labs provide the private well water customers with? Well, about 100% are provided, or close to 100% provided bottles for the sampling purpose. 100%, close to 100% provided written sampling instructions. Those who provided the verbal sampling instructions also provided additional written sampling as well. I was checking the results on that one. About 2/3 of the state labs and about 3/4 of the local labs provided guidance on what analytes to sample for. In particular, in North Carolina, they have a regulation where newly constructed wells must be tested for a mandatory list of analytes, and so they definitely had to provide that one. And for the coolers, about 1/3 of the states, and then that was a lot more than the locals, simply because of distance reasons, again, and sample preservation issues. Oops, I don't know if it's frozen up. Let's see here. There we go. Okay. Yep, that's the right slide. Okay. So how many of the labs actually physically collect the private well water samples? Not too many. If they did, they might have been the state public health laboratory. A couple of the examples that we heard from the labs about that were because maybe they heard complaints about certain samples or certain analytes and they needed to make sure that it was done correctly, so they go out themselves and to do it. Sometimes there were also some studies, some research studies that the states were doing, and so they need to make sure that all the samples were collected properly for the research purposes, and there are a variety of fees for that, but typically that was sponsored by either the research study or the health department trying to solve a problem. So most of the laboratories do test based upon a fee-for-service system, but if they do get other funding sources, what are those? So not too many have the additional funding sources, but some of the examples might be the general fund or the dedicated laboratory account that could help to fund private well water sampling and analysis, and then also those grants that I talked about before. And there was one, I think just one local lab that didn't charge for private well water testing at all. We're curious also to see how many partners and what were the different types of partners that the labs would work with. So the vast majority did work with some sort of partners. We had, let me see, I forget exactly the numbers here, but I think it was, I'm forgetting right now, but anyways, several states that work with the State Department of Health, State Department of Environment, and the local Department of Health altogether. We also were interested in seeing some of the other groups that the labs would work with, and so one state lab worked with some doctors' offices and community groups, and another local lab worked with well drillers, pump installers, and plumbers, so those were some pretty creative partnerships. So how many analytes does your laboratory provide private well water testing services for? So the colors are switched up here. The red is the state lab, and the orange is the local lab. And the states, so again, it was kind of 3 main ranges. So 10 or 11 states tested for fewer than 25 private well water analytes. 4 of those states were just 1 or 2 analytes, and that was commonly bacteria. There are 2 states that tested for 40 or 50 analytes, and then 3 to 4 that could provide testing services for private well water samples for greater than 100 analytes. The interesting part about that one is that some of the states who had lower numbers, they mentioned, well, we actually do have the capability for maybe greater than 100, it's just that we don't necessarily offer it for private well water testing. And so it was kind of a function of the question and how it was answered. With the local laboratories, it was kind of a range from 1 to 20 analytes that they could test for. So 3 tested for 1, 1 tested for 5, another one tested for 10, and then another one tested for 15 plus some volatile organic compounds. You're curious to see how their private well water testing menu was presented to the customers and private well water users. So there was a kind of variety of ways that these were presented based upon the states and how they developed it and what their needs were. But sometimes there were full panels that were presented, and then we had routine testing, regulatory testing, coliform only, anions only, cations only. And then another interesting set of packages were the homeowners package or the HUD, FHA, VA loan packages, or the standard water quality analysis options. Then we wanted to determine, what were the most frequent analytes that the labs were testing for. And Steve was mentioning some of these before about as far as what were recommended, and a lot of overlap here. Both the state and the local labs, top analytes were total coliform and E. coli. For the states, it was followed by arsenic, lead, nitrate, and nitrite. And then for the locals, it was nitrate separate from nitrite, and then fluoride. So this is one of those extended questions. We wanted to determine what were the differences between the analytes and how they were tested at the different labs. And so here's a few examples of some of those top analytes mentioned in the previous slide. So for total coliform, you can see that there are 3 different methods. All those methods should be validated. Our one question sometimes from APHL is, is that laboratory certified to perform that method, and what is the data quality that they're going to be producing? As far as the testing fees go, quite a range there. So for the states, between $10 and $40. For the locals, between $0 and $25. It was interesting because we heard that sometimes the states, they say that they aren't necessarily allowed to compete with the commercial labs. So the way that they price that out is, maybe at cost, or maybe it's more expensive, or it sort of can vary based upon the state requirements. And then the locals, that's quite a variability between nothing to test for and $25 to test for. I would be interested to see, if that $0, we talked about the barriers of testing beforehand with Steve, but does that make some people test even more and maybe make use of the service excessively, or perhaps it's a good thing. That's something I don't know. For the turnaround time, you can see that it is a pretty extended turnaround time, between 24 hours and less than 5 days for states, but shorter for the locals, between 24 hours and 2 days. And that could just be based upon the priority of the samples. E. coli was pretty similar to coliform. And then nitrate, so there are 3 different methods there. One thing I wanted to point out is that with the testing fee, you can see that you can't get the individual testing done for the nitrate, and it's usually part of the panel. That was the case for some states and locals. And so with that, the testing for the nitrate would be more expensive. Arsenic, so the one thing I wanted to point out with that one is the average turnaround time was 43 days on the high end for the states area, and that was actually just for a biomonitoring study, and so there weren't public health risks with that, with how those results we're getting back. Lead used the same method as the arsenic. And then, so once they went through that whole process of analyzing the samples, how did the labs provide the private well water results directly to the customer. Was it directly or not? And quite a few did provide it directly. If they did provide those results directly, they also included additional guidance on what that meant, and so that could be the info and guidance related to safety and quality of water, or guidance on treatment options, a comparison to U.S. EPA primary and secondary contaminant levels. So they did try to provide that background information. So how do they provide the results to your customers? USPS was the winner, followed by email, and then some other communication modes. One part I found interesting was that the local public health laboratories, occasionally they would provide those results in person if they found that there was an acute health risk with some of the private well water sample results. And then like Steve was talking before about the barriers, we wanted to see what the lab perception on what the barriers that the homeowners had, that they thought that they had. And so the labs, so we asked the survey participants to check all that apply, and then also within those ones that they checked to rank them. And lack of awareness came up as the winner for both of those, followed by cost and complacency, and then also access to sampling supplies and or drop-off. But sometimes they weren't sure why homeowners may or may not test their private well water. So if access and communication is an issue in the perception of laboratories as far as the private well water owners, do they promote the private well water sampling program? A little less than half did, and part of the reason for that may be related to what I was saying before about how they can't necessarily, some states, not all, but how they may not be able to compete with the commercial laboratories, and so therefore may not be able to promote the sampling program. But if they did, there were some interesting ways that they did that. So that could be through presentations or working at a booth at a water operator conferences, conducting private well water testing forums, supporting community-wide sample collection events, or even free testing during emergencies. And so they said the lab that responded with that, so they did advertise that. But this might be an opportunity for other partners of labs to be able to promote what the lab can do if the lab is limited in that area. Skip to question 12, but here's a couple pictures that some of the labs sent in. So this is the Oklahoma Department of Environmental Quality and some of the labs that, some of the wells that they've tested. This is from the North Carolina Public Health Laboratory. The top left is a sample kit ready to go out. Top right is a sample kit that's been received, and the bottom is their analysis in the lab. So all this information, what are the general takeaways and the next steps? So basically the survey results told us that there was a lot of variety in the lab capabilities. There's a lot of variety in how they interact with well owners in the system. A lot of variety in what they offer and also what they're allowed to do. But some of the commonalities were that they offered E. coli and the total coliform tests almost universally. They provided bottles and written sampling instructions. Most are funded through fee-for-service, and they usually have greater capabilities than what is advertised. And labs recognize that awareness is an issue with well owners. They recognize the value of partnering with experts who can give health advice or maybe do some of those other activities that would help to enhance the well program, and that the lack of regulations make this an even bigger challenge to ensure public health protection. Like I said before, some labs are not allowed to advertise, and therefore the public is not aware of their capabilities. A certified lab is highly recommended if possible. If there's no other option, of course, getting it tested is better than not. And the public health labs, with this data, they may be able to trend some of it to determine what those regional issues and challenges are. And they're eager to find partners. As far as APHL's next steps, so we've always wanted to get involved with private well water work if we can, and we do so when we can. It's kind of based upon funding. But some of our potential projects that we could do in the future might be to develop a group of best practices for all the lab work that's related to private well water sample analysis or in production, or maybe doing a best practices just for the the report out sheets. We've heard that sometimes those can be a challenge for the public to understand, and maybe to provide some best practices and trying to develop some consistency between that might be a good project. But that's all kind of funding and time dependent. And this is just a general quote from one of the survey respondents. A lot of labs are really interested in partnering, and she's saying that we're willing to partner with your division to help make this process as easy as we can for the client. Please reach out to us. Let's have a conversation and develop a strong partnership. So I'd like to acknowledge Lou, who's also on the phone here today from New Hampshire, Mary Hagerman from Indiana, Tammy Tyson from Saginaw County Public Health Laboratory. The three of them helped me in developing the survey in addition to Steve. The state and local laboratories who participated in the survey, Deborah Kim and Jacob Rosales from APHL Institutional Research, and the private well class for all of your collaboration along the way. So here's my contact information. I'd be happy to hear from anybody who wants to learn more about the nationwide look at labs and how they test for private well water samples, or maybe to be connected to certain states or certain cities or counties, the public health laboratories. So please let me know if that may ever be needed. So thanks.
Great. Thanks, Sarah. And again, if you have questions for anything you saw in Sarah's presentation, use the question box or chat box to ask those, and we'll get to them at the end. So we're going to switch to Lou Barinelli, if I can figure this out here. Okay. And it should have done that right there. So.
Okay, thanks, Steve. I hope everybody can hear me, and can you see my screen?
We can.
Excellent, excellent. So again, just let me thank you, Steve, for allowing me to be part of this webinar. And Sarah, you and both Steve have provided some great information before I get on. So today I'll talk about our experiences here in New Hampshire dealing with private well testing and some of our partnerships that we're working on and have been working on for several years now. So what I hope to talk about today is cover these topics about working with public health laboratories, what our capabilities and capacities are. Spend a little bit of time on data quality and defensibility of our data, and then in the end I'll talk about some examples of private well testing partnerships and initiatives that we are involved in right now or have been involved in. Now for the public health laboratories or environmental laboratories that are on the call today, I assume that the first two topics are probably just going to be a review, and we all know the importance of data quality and what our capabilities and capacities are, but we emphasize those two items when we're dealing with private well owners and or some of our partners that we want to work with, just to let them help them understand, especially data quality and what it takes to generate good quality data that people can use to make decisions on treating and environmental health decisions. So I'll spend just a few minutes on those items and then get into some of the examples. So most public health labs or state environmental labs are designated as the principal laboratories under the Safe Drinking Water Act. And because of that designation, we have the capability to do microbiological testing, inorganics and metals, organics and radiological testing. And so for our private well outreach, our private well work, for the microbiological testing, it includes the total coliforms and E. coli. And this is just reiterating some of the things that Steve and Sarah had mentioned earlier. For us in the inorganics and metals area, for private wells, we include nitrate and nitrite analyses, chloride, fluoride, arsenic, lead, copper, iron, manganese, sodium, pH, and hardness. Now those are common contaminants here in New Hampshire or things that we think are important for well owners to know. And as Steve mentioned earlier, depending on the part of the country that you're in, you know, this list might include more things or less or different constituents. But that's something that the public health laboratory has to sort of, with their partners, whether it's the drinking water program in their state or the geological survey, you know, you can work out what your lab is going to provide private well owners or your partners as part of your service. For the organics group, you know, for private wells, you know, we do recommend VOC testing, and particularly because it includes MTBE. In New Hampshire, MTBE was a big problem. It's a gasoline constituent, an additive, and so you know, we had a lot of MTBE contamination in private wells there in New Hampshire, and so we encourage that test. Not as common, but you know, we do have the capability of doing, you know, pesticide, herbicides, and other semi-volatile organic compounds as needed. On the radiological side, again, unique to New Hampshire and probably other parts of the country, you know, we include uranium, gross alpha, and radon as the recommended radiological constituents that we encourage private well owners to include in their test. So the other thing that comes up, and is mentioned earlier, is, you know, the question about when and what to test. So we've come up with a standard list, and Sarah mentioned this in her talk. You know, some labs call it the homeowner kit or the standard analysis kit, and we came up with this list in collaboration with our Drinking Water Bureau. And so I won't read off all the constituents, but it includes some you know, acute constituents that pose an acute health risk. So the bacteria and things like nitrate are included in that. Some chronic health risk constituents like arsenic, uranium. Again, from the radiological point of view in New Hampshire, you know, radon, uranium, and gross alpha are important naturally occurring contaminants. And so, and then we have a frequency guideline, as again Steve mentioned some of this earlier, on a 3 to 5 year basis to test for the complete list, and then annually for bacteria and nitrate. And the other thing that we sort of emphasize with our private well owners is, you know, the other times where you should retest your water, you know, if there's flooding going on, or if people notice any changes in color, taste, odor, that's another indication that we would want private well owners to retest their water. I'll just spend a few minutes on data quality. Again, it's something that we stress with our partners that we're working with and private well owners, because I think a lot of people see the lab as just a black box, and samples come in one door and the report comes out the other door, and they don't understand what it really takes to generate good quality data, and why does it take so long to get my results, and so we try and emphasize that data quality is very important. Public health laboratories are what I call the gold standard. We all have robust quality systems. We have accreditation, do performance evaluation samples, undergo or follow strict quality control policies and procedures, and all of that is needed in order to generate good quality data. And again, I just put up our mission statement. Public health laboratories, state environmental laboratories, we have no agenda other than to provide the highest quality data that we can for our customers. We don't sell treatment systems. We don't have any connection with anybody else other than the the private well owner, and that's our only agenda. So what do private well owners and partners need to know about that data quality? And I look at it in three parts: pre-analytical steps, the analytical steps, and the post-analytical steps are all. I think you can look at those as three unique parts of the big picture, and each one has an important role to play in generating good data. And we go, we go over these with our private well owners who use our lab for sample testing, and our partners. And I think the pre-analytical step, it may be, maybe the most important part of the whole process, because if the sample is not collected properly, then no matter what you're doing in the lab, you may not get the right result. So, we emphasize using proper containers, proper preservation, whether it's chemical or temperature, transportation to the lab within the holding time, bacteria in particular, less than 30 hours, nitrite samples, less than 48 hours, the importance of documentation, filling out the paperwork with the right sample ID, the date and time collected, all the information that's necessary to document where the sample came from, what kind of sample it is, what tests we're doing, and the transfer from one person to the other, and maintaining chain of custody of those samples. The analytical process, labs should know this, but we're following approved and validated methods. We have written SOPs. We're following strict quality control procedures, and I list them down here. It has to do with calibration and controls throughout the analytical process. Again, just making sure that we are generating the best data that we can. And then post-analytical involves reviewing and approval procedures, the steps necessary to ensure that the results that are going out on our final lab report have been reviewed, checked, and we make sure that, to the best of our ability, that those numbers are accurate, that all the quality control criteria have been met throughout the process, and hopefully that the report is accurate and can be used to make some environmental or health decision. So the last part of this will deal with some of the partnerships and private well initiatives that we've been working on over the past several years. So I'll try and describe to you who do we work with, what kinds of things do I think are working with respect to private well testing and outreach, and maybe some of the things that we need to work on some more. So I've listed a bunch of groups that we work with, and not necessarily in any particular order. Some I may spend a bit of time on, and some I might just mention. So our New Hampshire Drinking Water Groundwater Bureau is probably one of our critical partners. They are the lead agency in New Hampshire for all things drinking water, and they are our best resource. As Steve mentioned earlier, laboratories need to be able to help private well owners answer a multitude of questions regarding what to test for, what the health effects are of some of the constituents, how to treat. And so we try and field most of those calls here at the lab, either with our central receiving staff or some of the lab managers. But if there's a question that we can't answer, we defer to the Drinking Water Groundwater Bureau. They have engineers that are willing to take calls from homeowners and answer all questions related to private wells. And we work with them to generate that standard homeowner package that we promote for private well testing. We have been partnering over the past couple of years with our New Hampshire biomonitoring program, and I'll go in a little bit more detail on this one in a few slides, but we've just completed working with them on a targeted arsenic uranium study, and we're about to embark on a statewide surveillance study for the biomonitoring program. We're working with our Healthy Homes and Lead Poison Prevention program, so we are partnering with them in any childhood lead exposure investigation that they are involved in. We are analyzing a water sample for lead to determine whether that's where the exposure is coming from or contributing to the exposure. We have partnered with many in New Hampshire or maybe in other parts of the country. We have local conservation commissions, and we've partnered with many of them. And I will elaborate on that partnership a little bit later as well, or any other community environmental advocate. I just bunched those up together. That's a group that we have been we've reached out to and have reached out to us to help with some private well testing, and that seems to be a really good partnership that has resulted in a lot of private well testing opportunities. We try to work with school science fairs when we can, and in those partnerships, it's typically we attend them, bring private well testing information, have kits available for people to pick up. I think Steve talked about barriers to testing, and I'll touch on that a little bit later as well. So we're trying to encourage people to do private well testing and break some of those barriers. And one tool is just to get them the test kits and the information about testing, and hopefully they can return those kits back to the lab. That helps a little bit, but it's not the best approach, I think, to get people to test their water. We partner with a lot of health officers and local health officials, either by providing them with private well testing information, pamphlets, making kits available to them. They can reach out to us if they have issues in their local towns that involve private wells. Same thing with working with town events, farmers markets. Recently we had a booth at Boy Scout Jamboree and Boy Scout Yard Sale where we had people there handing out water test kits. In one event at the Boy Scout Yard Sale, we actually handed them out and told the people to return them the next day. We would collect them and bring them back to the lab, so we would do the transportation for them. That seems to work very well. Another group that's very important to us in New Hampshire, we have a Dartmouth Toxic Metal Superfund Research Program. They work with us very closely in our private well outreach and initiative, and again, I'll talk about that a little bit more in detail in a couple of slides. USGS, we've worked with them for doing some private well surveys throughout the state of New Hampshire, statewide arsenic, uranium survey where they go out and collect samples throughout the state. We were their lab for doing the well water testing. Another partnership that we just recently formed with the Children's Environmental Health Disease Prevention Research Center at Dartmouth to reach out to pediatricians and ask them to talk to their patients about private well issues and provide them with test kits to have their wells tested, and with several different options because we know that cost might be an issue. So something as simple as just doing a bacteria and a fluoride test at a minimum, or a little bit more expanded and include arsenic and some of the other parameters. So that seems to be working well as one of our partnerships. So let me spend just a little bit of time about our collaboration with our biomonitoring program. As I mentioned earlier, we're just finishing up on a targeted arsenic and uranium public health study where we tested about 500 private wells and 50 municipal wells. The 50 municipal wells were the controls. And so we came up with a list of analytes that we were going to offer the participants who were going to be in this targeted study. There's a picture on the right-hand side of what the sample collection kit looked like, both for the clinical and the water sample. So from the water perspective, you know, the participants got a free water test that included stagnant lead and copper, and then a flushed water sample that included arsenic, uranium, manganese, cadmium, lead, copper, iron, hardness, VOCs, and pH. So some of those were related, obviously the arsenic and uranium is related to the study, and then the other components are there based primarily if they did have an arsenic exceedance or needed to treat for arsenic. Some of those other constituents are there to help design the treatment system if they had other issues as well. You know, we use a stagnant lead and copper sample as a measure of water's corrosivity if there's some issues with that. So that was a really, you know, again, it was a sort of used as an incentive, a free water test incentive for getting people to sign up for the study, as well as now getting some private well data. The next statewide surveillance study that we're about to embark will involve another, you know, 300 to 400 private well samples. This is going to be random sampling throughout the state. We've expanded the analyte list that I've shown there at the bottom. The analytes that are shaded in a tan color, those are matching the analytes that are being tested in the clinical samples for this surveillance study, as well as the typical other parameters that we normally provide for private wells. We're also partnering with 2 other programs in the state in this effort. Our environmental public health tracking program is funding the cost of the well testing or the lab testing for the water samples, and our environmental services MTBE program is actually going to fund the cost for the VOC portion of the testing and collect all the samples for the study. You know, in New Hampshire, the state was awarded a large sum of money in several litigations with oil companies related to the MTBE issue, and so we have a program now that has some monies to spend on well testing and doing something like this. So here's an example of, these are 2 other state agencies or state programs that are coming together to actually, you know, go out and collect private wells, and our lab will do the testing. The other I think initiative and partnership that we have that's working very well is our private well initiative and community engagement effort. As I mentioned earlier, one of our partners, our environmental services department, and partnering with Dartmouth Toxic Metals Superfund Research Program, you know, we've, over the past 5 or 7 years, we've had this private well initiative program that's evolved, I think, a lot, and partly because of this CDC grant that was awarded in 2013 to assess and manage risks associated with exposure to arsenic from private wells in New Hampshire. Then some of this information that'll come up in the next slide or two, I think Steve had mentioned earlier, related to barriers to private well testing and barriers to treating. And after that grant, the laboratory with our partners focused on how do we break those barriers, and I'll try and give some examples of that shortly. But I think Steve and Sarah mentioned some of these. This is from a survey that we took part in or had information. I meant to have it tested. I didn't know about having it tested. The water looks, smells, tastes clean. All reasons for not testing. So one of the things that we're doing now is sort of some social media, some marketing. And if you look at the picture on the right hand of the slide that says "Why test?", if the picture of that little girl doesn't answer the question is why you should test your private well water, I don't know what will. So we're trying to get people to understand that it is important to test your water. And the barriers to treating, again, just the different reasons why people don't treat their water. And one of the ones was, 1 in 3 people don't know what to do with their lab results, and that's the reason why they didn't treat their water. They didn't know that they had to. And I think, Katie, I think we want to do a poll question now. Is that right?
Yes. I have a poll question that I will be prompting up here on screen shortly. Let's see here. Okay. So I have launched a poll. So when a lab reports private well water results in a very clear and understandable way, it's one of the most important steps towards ensuring that well owners know the next steps that they need to take to protect their health. So the Private Well Class and Association of Public Health Laboratories, they'd like to collect examples of laboratory private well water report forms. It says consumer on here, but just your regular report forms to determine some best practices. So if you guys can go ahead, if you're attending, and answer this poll. So would your lab be willing to share your private well water report forms with the Private Well Class and APHL for this purpose? We're recording your answers, so if you would like to share your report forms with us, we can reach out to you via email after the webinar is over and ask you for those report forms and start a partnership that way. So I'll leave the poll. Oh, go ahead.
I was just saying, and we'll share this with everybody, just so you know that. I mean, our program is meant to be completely publicly available, so yeah.
So I'll leave the poll open for about 10 more seconds. We still have a couple answers filtering in, and then I'll close the poll and it will show up what everybody voted. So, all right, I will be closing the poll. Let's get your answers in. All right, and looks like 60% of you are willing to share your answers with us after this webinar, so that's great. All right, Lou, I'm going to give you control again and hide this results of the poll.
Okay, am I set to go?
You are.
I just got a few more slides to go, and so again, continuing on, we've been working really hard to break these barriers to get people to test their private wells. Here's an example. So one of the things that we have been doing. So again, there was a local conservation commission in the town of Tuftonboro, New Hampshire, where one of their members attended a source water protection conference put on by the American Water Works and our environmental services group back in, I think, 2012 or so. And they approached us and said, we want to have everybody in our town test their well. What do we need to do? And so we worked with them, and essentially the way the program works is that we provide water test kits to the group. They hand them out to the public. They designate a certain date and time where everybody brings their collected sample back to the town hall or the police station between the hours of 10 and 2 or whatever time it is, then people from that group collect them, store them properly, and then deliver them to our lab the next day. And as what the slide is supposed to represent is that for that particular town, we track the number of private wells that we were receiving on a monthly basis, and 1 or 2 samples a month. And then when we had these designated town-wide collection events, that's what we're calling them, you can see the spike that shows up. So, in the first year we did, July in 2012, we had about 90 participants. July of 2013, we had over 160. July of 2014, we're back down to 100, and then July of 2015, we're back down to, 60 or so. So this town has been doing that on an annual basis since then. The numbers tend to go up and down, catch everybody, and then we catch some new people next year. But we found out that this type of partnership seems to bring in the biggest bang for our buck with respect to return on the number of private well samples that we get based on the number of kits we hand out. It's almost 100% return when we can schedule a particular day and time where people can drop the samples off and have somebody else courier them to the laboratory. So what we've been doing is the group has been going out and out into the community with these community presentations. Private well users know what your water, and we go when we're invited, and we cover these topics. Private wells in New Hampshire, contaminants, testing, treatment, and community engagement. And then we hold one of these community testing events either the week after or a couple of weeks after the town-wide information meeting. It's really organized by somebody at the local level. They do all the advertising, the marketing. They get the people to come out, and then we show up on a weeknight or something and give like a 1 hour 45-minute presentation, cover all these topics. The other thing that we do, and I'm not sure whether a lot of people know about this, but part of that CDC grant involved creating this web tool. It's called Be Well Informed. It's a web tool to break the barrier about understanding your lab report and what to do with the results. So you can go here, plug in the results from your lab report, and then it will provide the well owner with a nice user-friendly report that helps them understand whether they have an issue and whether or not they need to treat and what type of treatment is required to fix that particular problem. Uses things like a green check mark for everything that's good, a big red X for something that's bad, and then if you have multiple contaminants, it will actually guide you through the treatment train, if you will, on how to take care of those contaminants, whether it's a whole house system or just a point of use system or some combination of the two. The last thing I'm going to touch, I know that the slide on the right-hand side is pretty colorful, to say the least, but can be complicated. What we're trying to, because we have limited resources in our private well initiative and outreach program, we're trying to figure out how we can target certain communities where our efforts would be most useful. And so we've tried to map out based on 4 factors of where we should target our outreach. So we've looked at a statewide map, a USGS map related to the probability of having arsenic in your well. And so if the probability is high, then you're at higher risk. You get a certain grade score. We looked at the map with respect to whether communities have more private wells versus public water systems. So if you have more private wells, you could be at higher risk to exposure, so you get a higher score. We looked at median income. So theory is if you're lower income, you're less likely to test, so you're at higher risk, so those towns got a higher score. And then educational attainment, if, theory is if you have a lower education, you're less likely to get the test. You're a higher risk, so you get a higher score. So you put all those scores together, and of course the towns that are in red on the map are those towns that, according to this grading scheme, might be at higher risk for exposure to arsenic. And so we think that maybe we should target those communities for our private well outreach initiatives and try and get more people in those communities to test their private wells. So that's the latest thing that we're working on with our partners. Those are our environmental services group and our group at Dartmouth. So I think, yeah, so hopefully, I gave everybody a sort of a sense of what we're doing here in New Hampshire with respect to private well testing and some of the partners that we're working with to encourage and enhance the number of people with private wells that get their water tested. So again, the three big partners that help put this thing together are the folks at Dartmouth, New Hampshire DES, and our biomonitoring program. So I think that's all for me, Steve. And I don't know how to give anybody control.
Oh, no, that's all right. I'll take care of it. Thanks.
Okay, great.
Let's see. Cancel. I hit the wrong button, so hang on one second. Make presenter. Okay, so the next thing that we're going to do really quick is a Google Doc exercise. So Katie's going to post, I think, in the question box. Is that where you're putting that?
Yep. So we're going to do a quick Google Docs exercise, which is basically a document that everybody can edit and have access to. So I posted the link in the chat box. I sent it to the entire audience of all you viewers out there. And Steve, yep, and Steve also has it, the link, in case you cannot click on the link on the screen there.
Well, yeah. It's not really a click on, it's just to let you know. So you can see all these people signing on. Go below the line. There's two things here. Go ahead, Katie. Sorry.
Oh, yep. So there's 2 pages in this document with questions. And the 2 questions are, what tools and resources would benefit your lab? And the second question is, what current issues is your laboratory facing? So if you would click on that Google Docs link and just type out your answer, everybody can type at the same time. You'll be symbolized by an anonymous animal and a color. So once you get in there, you can type out your answer, and it's really good.
Yeah, it's like a Word document. So you can, there's 2 pages here, and I'm on the first page. I can click here and also add stuff if I want to. But if you scroll down to the second page, there's a question, what current issues is your laboratory facing? And so we want to give you a few minutes to do both of those questions. And so again, if you're not a lab, you can see what's happening here. It's kind of an open interface, so weird things happen sometimes, like somebody will type up in the title. But if you would, and if you keep the link, we'll leave it up, so we'll share it with everyone, so you can see what everybody else is doing. So try to find your separate line and just start going.
And like Steve mentioned before as well, if you're unable to access the document, just view what's currently happening on the screen that Steve is displaying. So, and we'll give everybody a few minutes to type out some stuff.
And then after we're done with this, we'll go on to the questions that you all asked in advance and that we've put on slides to go over. We have, I don't know, 10 or 12 of those, I guess. That all should be pretty related to what you do. And the other thing I should mention, I guess, is that when you have this up in your own browser, you can scroll up or down all you want and see what's there and move on to the second page. And yeah, sometimes these things, like I said, it's kind of an interesting exercise that we've started doing for a lot of our, when we do a real class. We haven't done it for too many of our webinars, but when we do an online class, like for environmental health professionals, we get a lot of good feedback, and it's information they can learn about each other and what they're doing as professionals. So it's pretty helpful to have up.
I love the anonymous animals.
Yeah, one of the good things is everybody's anonymous, so your answers aren't recorded for who you are or whatever. It just shows that everybody is typing as anonymous color and animal. So.
Yeah, that's true. This does say anonymous. The last time we did an environmental health professional workshop, you were a color, so you could be a blue rhino or a green rabbit. So it's actually pretty clever. Google developed this. So
yeah, it is. I'm jealous of the walrus.
Let's give everybody another minute, and then we're going to move on. We are going to run late, so hopefully I appreciate everyone sticking around. There's certainly some good questions that have been asked, both in advance and during the webinar today, that we'll get to, as long as you're willing to hang around. And in the end, Katie will go through this and correct, spelling errors and different fonts. Sometimes we see, big letters and little letters and everything else. So don't worry about that stuff too much.
Yeah, and like Steve mentioned also, you're able to go back in and read through the answers and all the responses that everybody has posted. So it'll be there indefinitely for everyone to go through and look at.
Some of these, we're not going to go through them today just because of time, but someone mentioned here printed materials that were the same throughout the state. I'm going to address that a little bit, because that's one of the issues that we found working all over the country, is that things are so different. Some states have more wherewithal than others, or more resources to provide to their counties or their local health districts than others, and there's just things are very fragmented, and folks are doing things in a number of different ways. And what we've tried to do through our program, which is meant to be national in scope, is to find a way to more standardize some of those things. And so a good example would be, we looked at the 100 or so different documents out there on how to disinfect a private well, and we chose the one that we thought was the best, and that's what we share with everyone. And it turns out it's from the Minnesota Department of Health. It deals with all the issues you might have when you're trying to disinfect your well, walks you through it step by step with pictures and tables. And so we want to do more of that sort of thing. So I'm going to talk about it in a few minutes or after the questions, but we've developed a brochure that you can pass out that allows you to put your own label on it, and it just talks about some basic things that well owners need to do, for instance. So I'm going to go ahead and start answering questions. You, as the attendee, certainly have the opportunity to continue writing on this as we go, but I'm going to move it off the screen for now. And can everybody see my screen now?
Yes.
Okay. Then I am going to move on from here. So, and again, feel free to either continue writing, like I have two screens, so that's kind of handy, or you can always add to this a little bit later. If something comes up and you think of it, again, you're sharing it with the whole group in the end. So, So I'm going to go through some of the questions we got. One, and this is kind of the format we have. And Dan, are you still here, I hope?
Yeah, I'm still here, Steve.
All right. So a few of these Dan has answered as well. I'll let him answer those. But I'm going to go through some of the questions we got. There weren't as many from lab folks directly as I thought there might be. And so we'll answer what we can. So is water testing for springs the same as for private wells? One thing I want to mention is there's a lot more springs out there than I realized. I mean, we have them in southern Illinois and Indiana, Kentucky, Tennessee, where there's a lot of caves and those sorts of things. But it turns out there are springs really everywhere in the country, and a lot of states are dealing with folks who like their springs and think the water's great, when reality is they're much more likely to be contaminated, especially with bacteria. But as far as testing goes, it's groundwater that's coming out of the ground, basically, so it's not really surface water. And if you're using a spring box, or it's you've got a cistern that it runs into, or something like that, then really there should be no difference if you're sampling from a spigot or a faucet. And if this question was directed toward sampling at the source, then there's other issues there when you're sampling kind of more on a research side. Turns out my boss has done a lot of work looking at springs and water quality in springs. Yeah, so anyway, you should expect the general chemistry to be similar, except that you're much more likely to have bacterial contamination, and we see a lot of springs with issues all over the country, just because typically that's a karst environment where things can infiltrate into the groundwater much more easily, and so you see a lot more animal material and things like that. So there's also a question about field testing kits, if they're available, and are they as accurate as lab tests. So there's a number of issues. One, no two kits are alike. And Dan, in a minute, feel free to weigh in. I'm going to go through this really quick, but it depends on the constituent. I know some are better than others, and some actually are fairly accurate. But I know one of the questions today was about pesticides and a home kit for pesticides, and I can't imagine we've got to a point where those are great. I know what we use them for a lot of times is for a qualitative answer. So it's a good screening tool, especially things like we've used the colorimetric kits for arsenic, where if it's close to the limit, it's kind of a yellow. If it's really high, it's a much darker color. I'm colorblind, so closer colors are different to different people, but if it's really dark, you know that it's got a fairly high amount of arsenic in it. And so qualitatively, they may be a good screening tool. I think we would recommend that you always take things to a lab. Plus, there's a much more chance of a false positive or negative with those kits than you would get in a lab. Anything to add, Dan or Lou?
This is Dan. A great answer, Steve. I mean, you described my experiences very well. Sometimes they seem like they can be good answers, but sometimes it seems like there'll be, I'm colorblind too, and I have difficulties with some of the colors that, to me, the color charts don't always match the color of the solution is another thing I've experienced. So they're kind of, it's darkness of shades is hard to distinguish when you have different colors involved. So I generally trust them, but more like what you're saying, more of a screening tool.
Yeah, I don't think I answered it in this set of questions, but someone did ask the question about a home kit for pesticides, and our response would be to go get it tested at a lab before you do anything else, just to be sure, because it's, I think it's likely, I think it was like a 300-foot well. It's not a kind of a common place where you'd see a pesticide in a well, and yeah, anyway. Okay, so how do you identify road salt contamination versus natural chlorides? Well, so chloride is really the best indicator for salt water, or for road salt, but there's a paper, it turns out, Sam Pano, who's with the Illinois State Geological Survey, and has done a lot of work looking at chloride in road salt. We have Chicago, so it's quite a test bed for those things. We see it in our rivers and streams, as well as in our shallow groundwater up there. And there's a really good approach in this paper on how to actually use a chloride versus bromide ratio to graph it and tell what that is. And I refer you to that. if you are interested in that particular paper, you can email us and we'll get a copy for you. That's probably the best way to deal with that. But we certainly see a lot of road salt problems in urban areas, and especially shallower groundwater. So private well regulations. The question or statement was, I want to learn about the regulations for private wells which we should obey. So I wasn't 100% sure if this was a lab or an individual well owner who may have be participating today, but it's a good chance to really talk about this is a huge issue because regulations, there should be regulations on all pieces of a well. You should, in Illinois, you have to get a permit to drill a well, so you need permission to put one in. Out west, where they have a lot of land right issues, you may not be able to get permission to put in a well because you don't have prior rights there. So it really depends on what state you're in. Then using a licensed driller or contractor, as I mentioned, 2 states, Alaska and Pennsylvania, don't have well construction code, or they don't license drillers. And so we would recommend that you do that regardless. And I know some of the counties in Pennsylvania have passed their own rules that say you have to be a master well driller through the National Groundwater Association, which is a classification, kind of like a certificate for a well driller to show that they've passed this test and that they're kind of a master driller, if you will, in order to drill in their county. So most states now require, but not all, with new construction, some kind of sampling. It varies by state, and so you really need to look at your local regulations. And then there's a lot of property transfer rules, which I'll talk about in a minute. So in some states, whenever you buy or sell a property, either HUD, if it's a VA or FHA or HUD loan, or maybe the mortgage company or the state itself have rules about what you have to do to sample. And they really do vary. In Illinois, they sample for coliform and nitrate, and that's it. In some states, you're required to have your state lab go out and collect a sample for you. And so it's really worth understanding those things. And in places, so I mean, the differences are so dramatic. In Illinois, we have 102 counties and about 85 county health departments, or sometimes they're multi-county health departments. And you get a permit from the county. Those logs end up here at the State Water Survey as well as with the county. But the rules for sampling are pretty consistent, and it's kind of governed by our Illinois Department of Public Health. But in Massachusetts, there are over 500 and some odd public health districts. Everyone has the right to create their own rules. So you could have 2 local health districts. One on one side of the road has sampling for everything under the EPA Safe Drinking Water Act, which is really a burden on the buyer and seller, to having no rules at all. And so there's no consistency around the country on how those things are done. And that's why you really need to understand locally what's going on. And if you're in a state like Massachusetts, you even need to understand, if you're a lab, you're a regional lab, and you work with folks in a number of health districts, trying to understand what every health district does, I'm sure is a burden or a nightmare, depending on how you want to look at it. So EPA compliance. Must EPA methods required for compliance testing be used? It's only required if it's for some particular reason. I know, like in Pennsylvania, they do testing because of fracking, where they'll have a lab actually has to even collect a sample so that it's considered, quote, legally defensible. But it depends on what you're using the sample for, and it also depends on what the well owner is looking for. It's like treatment equipment. You can get those that meet UL standards for removal of arsenic that have that stamp on them, and it's maybe costs 3 times as much as another set of treatment equipment that doesn't meet those criteria, so you're not sure what you're really buying. And so there should be some standardization. What we recommend to well owners is they use an EPA certified lab, and we ask the lab if they're sampling using the required EPA methods, because you see that as well too, where they can actually test in 2 different ways. One's easier and cheaper than the EPA certified approach, but then you're really, does a well owner understand that? Probably not. And so, and to ask a well owner to understand that, is really asking a lot of the well owner. So for me, as a lab, I think you have the responsibility to inform your customer about the method you're using, especially if they're not an EPA method, so that they can understand the differences and whether to pay more if it costs more to have it done that way. And this last statement's really is the main thing. Well owners are trusting you as a lab to do right by them. And if anybody else wants to comment here, feel free.
Yeah, this is Lou, Steve. Thank you. I think that's a great answer, and I think that's why one of the slides that we put up earlier is the whole data quality thing, and I think I agree that we should be using validated methods, EPA methods, and just explain to our customer that we want to give them the best, reliable, most accurate piece of data that we can, because that's what they should be using to make decisions, and because of that, that does make the cost go up potentially, or the time factor. And I think for the most part, in our experience, when you do try to explain that to somebody who's not a lab person, I think they get it in the end, and they agree that that's probably the best thing for them. So yeah, I know there are easier ways, but from our state lab, from our lab perspective, and I know our QA officer, I don't think she would let us do anything but follow approved, accredited methods that we perform here in the lab for our routine work. I mean, there are exceptions and emergencies or something like that where you might want to. But those are for screening purposes or something like that. So I agree.
Thank you.
And this is Sarah. I'd like to add one thing. If this well water sample results ever have any legal implications, it's best to have results from a certified lab so that they can stand up in court.
Even to have someone else collect them, which is what they do in Pennsylvania, I know. So that way there's no question that the well owner did it themselves. So. Okay, so emerging contaminants. What emerging contaminants are important in the Midwest? So, there's always going to be emerging contaminants. It's lead, now it's PFAs. On the community water side, that's algal blooms. These things all make it in the news, and they get the most press. And as I said earlier, we know where those things are likely found. PFAs are fire retardants. You see them at airports and after forest fires, or even when a house has been on fire, we've seen where the wells around a given, if it's a small community that has all private wells, they may have PFA contamination. But we understand where those things happen, and the vast majority of private wells probably don't have those emerging contaminant issues. So it goes back to, again, understanding what your risk is. And so for a well owner, it means they need to know if any of those things could be an issue for them, especially like lead. Is it an older home? All those things. But for many more well owners, it's really because of the things I mentioned earlier: poor well construction, the lack of just understanding their geology, how their well's constructed, is it really safe. And so the thing as a lab, my message to you is really that you need to be providing well owners with information and education so that they can learn more about what it means to be a responsible well owner. So it's typically not that an emerging contaminant is a widespread problem for private wells. Yeah. So confusion over required testing. There's 3 or 4 slides here. So there was a question about from a lab about the new rules for a VA loan. And I'm going to address this. We also do a webinar for realtors, and so there's a number of slides here in a row that are about this issue. So what water quality tests are required for sale purchase of a new home? Do they vary? They vary a lot, as I mentioned before. So in New Jersey, for almost 20 years, they've had a rule that whenever a property is sold with a private well, the state lab comes out and collects a sample. At least when it started, it cost $600. And it was up to the buyer and the seller to agree on who was going to pay for it. And the results only go to the buyer and seller. No one else gets to see it. I know I asked to see their data, and they said no. So that's one end. And actually, Rhode Island has since passed a law that ties it to their building inspector. And so when you sell a property, the building has to be inspected, and if it has a private well, it has to be sampled. If it has a contaminant that's over an MCL for, the Safe Drinking Water Act MCLs for public water supplies, they require you to remediate that, either add treatment or do what you need to. If not, the building inspector has the ability to condemn the property as unlivable, which means you can't sell it. So you have that on one end, in one extreme, and on the other end you have really no rules at all, and that's why you see lenders and mortgage companies stepping in. Even HUD have developed their own requirements in an effort to make sure that they're protecting the value of the property. So so there was a question about VA loans, and so I'm going to get to that. This is it. How are our labs addressing the requirements for testing by a third party and what tests to perform? The rules expect there to be a local health agency. I looked into this, and I've tried to deal with this for a couple of years because there's a lot of misinformation out there, and people aren't doing the same things in all areas. And what it leads to is unequal protection for a homeowner. And I think it should be more standardized. But the idea between under the HUD, the FHA document, the 4000.1 that everybody uses when they're getting a VA, a FHA or HUD loan, is that it should be a local health agency collecting the sample. But if there isn't one of those folks, then they may ask the lab to be the independent third party. So, but as has been mentioned today, some labs do this as a routine service, so they could provide a legally defensible sample. But there's a lot of other issues regarding this, and especially in the loan requirements. The HUD document 4000.1 is over 1,000 pages, and it doesn't even treat a new well constructed on a property the same way it does an existing well on a property, which doesn't make sense to me. So if you want to deal more with this, or if you'll give me the specific questions you have regarding the VA loans, I wasn't able to find just the VA piece of this. I would appreciate it, because I've tried to work with USDA and HUD and trying to get people to the table to understand that things are they're out of whack with all of this stuff. And here's what the rules say. The mortgagee must confirm that a connection is made to a public or community water system whenever feasible and available at a reasonable cost. So the bottom line is, if you buy a property and there's public water nearby, if it's a reasonable expectation, you can't even use your well. You have to hook up to city water. And I don't necessarily think that's a bad rule. In a lot of cases, as I mentioned, we run into well owners who don't know anything about their well, what it means to be safe. They don't test. They don't even know where their septic tank is, things like that. So the HUD rules basically say, first, if a well owner has the opportunity to connect to community water supply, they have to. But in lieu of that, the next piece of it is, and this is the rule today, if you have an individual water supply system or a private well, then you have to ensure that it meets the water quality requirements of the local health authority. If there's no local health authority requirement, then it has to meet the state water quality standards. If there are no state water quality standards, it has to meet the EPA National Primary Drinking Water Regs, which is the Safe Drinking Water Act, which would cost a well owner thousands of dollars if you really sampled for everything under the Safe Drinking Water Act. And what I can tell you is that almost no one actually does that. So most folks aren't even following the rules. And what that's led to is a lot of misinformation and even letters to like a mortgage company so they can get their loan. And here's an example. So a national organization that works with well owners has been writing letters on behalf of well owners who want to get loans and sending this document out that says this is what HUD requires: lead, nitrate, nitrite, total nitrate, nitrate, coliforms, and fecal coliform or E. coli. This was in a letter that HUD put out in like 1994. It's like mortgagee letter number 36 or something. When I first got a hold of this, I actually used it in a webinar. Then I asked to find the information. No one could find it. I dug and dug and dug and dug and found this on a mortgage company's website in Michigan. They'd taken that old letter, took everything else off of it except this table, and they're passing this out as this is what's required. And it is not what's required by HUD. It's what I mentioned before. So mortgage companies and banks are letting people sample just for these things, and then and it's not what HUD requires is the bottom line. And so there needs to be some standardization. There's a lot of misinformation, and it's really that simple. If there's a local jurisdiction, you sample for what they require. If there's a state jurisdiction beyond that, that if there isn't a local, you have to do that. Otherwise, it's the EPA public water supply requirements. And the problem is, if I live in an area with a local jurisdiction that only requires bacteria testing, then when I buy my house, I'm only testing for bacteria, and that isn't protecting a well owner or the value of their property. We had a well owner in Illinois where they sampled for coliform and nitrate. They bought their property. 3 years later, she tested their well. They had 150 ppb of arsenic. So she called me, mad as a wet hen, wondering why the state of Illinois didn't protect her better. And so the message we give well owners is it's buyer beware if you're buying a property. It's really important that you make sure you get a sample, you test it for all the things that could be a concern, and you're informed before you go into purchasing that property. Now, she's bought a property where there's known arsenic. She didn't know it because she moved in from out of state, and the value of her home isn't really what she thought it was. So, so anyway, that's all I'm going to say about that. Quite a bit, I guess. But one of the other things I want to mention, there were several questions about sampling. Where is it best to sample and why? What our lab does and what Dan's does is that he talks to a well owner in advance when they call and finds out if they have treatment, how old their home is, a lot of those details. And then a lot of times he'll send them 2 sets of samples. One to get a sample from an outside spigot that's before any kind of treatment, that's more groundwater or more representative well water or natural groundwater, and then one at the kitchen sink that's after treatment, after it's been through the pipes. It's actually the drinking water. There can be significant differences. And understanding those, from my perspective as a groundwater hydrologist, I want to know what the groundwater quality is a lot of times, not what the drinking water quality is after it's been through a home and a softener and a filter and everything else. But also on the public health side, you want to know what that is at the end that you're actually drinking. So we usually recommend both, and it's led to a lot of interesting information from us. We learned after the arsenic rule was changed, we looked at a bunch of samples that Dan's lab had ran where they had arsenic in the groundwater sample and what the difference is in the arsenic in the finished sample, and we found that on average, and this is a small sample set of about 100 wells, softener took out 42% of the arsenic. That's not something you can hang your hat on. A softener isn't meant to take out arsenic, but because it co-precipitates other minerals, it can do that. So you learn a lot that way. And you know, the example here is I'm going to show you a well sample, and we use this when we talk to environmental health professionals. Someone asked a question about sodium, and so I'm going to address that here, about what sodium load does a softener put on in a water sample. So this is a raw water sample from an outside spigot where you can see the sodium is 25.9, the turbidity is 29.8 over on the right, color is 48.1, pH is 8, and the hardness is 351. Okay, so there's 3 samples here. One that's a raw sample before any kind of treatment, one after a filter and softener, and then one after that that went through an RO unit. And you can see the differences here, and it makes it really clear what's going on. So anything with a less than symbol means it's below detection for our lab. But whenever you add a softener and filter, it's a regular salt softener. The sodium went from 25.9 to 198. But at the same time, the hardness went from 351 to 0.68. The turbidity and color both went way down. And so, you know, they've done their job, is the bottom line. A lot more things are less than, and it's taken out and done what it's supposed to do. But if you're on a low sodium diet, you've certainly increased that if you're drinking a lot of your tap water. And then when we add the RO unit, obviously it takes out almost everything. You can see here that a lot of less than signs, but one unintended consequence is that the pH went down to 6.23. You know, I'm not a chemist, but it's the, you know, the buffering that goes on, has a lot of that stuff's been taken away. And so if you happen to have a whole house RO unit, you've lowered your pH where it's a little bit, you know, it's on the side of where it could actually leach lead solder and things like that, where in Illinois we're fortunate enough that most of our groundwater has a pH of over 7.5. There's things you can do to reduce that. So anyway, that's an example I think you can all relate to as labs and lab professionals. It really makes a difference on where that sample's collected and the effects it might have. And I'm just showing this here, I think, because I wanted to leave it in case I forgot to mention it while I was going through those. Okay, so that's the questions that we did today. I'm going to spend 5 minutes talking about our class, and then we'll get to the 6 or 7 questions that you all have asked here at the end. So the private well class, which is an online class of 10 lessons meant for well owners, self-paced. You sign up for it. It emails you a lesson once a week for 10 weeks. We also do webinars for well owners, for labs, for realtors, and for environmental health professionals to help them understand wells better and the issues that they have, along with some other things. And it's just privatewellclass.org. This is the front page. You click on Learn by Email, and it takes you to a page where you can sign up for the class. With each lesson, so lesson 1 is called The Science of Groundwater. We provided a lot of other resources that are publicly available. You can click on. This is all free. It's funded through RCAP and US EPA. And so there's this sort of resource for all 10 lessons. And the goal of our program is really to help well owners understand why their well is important, why they need to understand how it works, and what they can do to help protect themselves from risk, especially with contamination, and also protect their source water, their aquifer. We do specific webinars. We did one on lead in 2016 in August. We're going to do that again, I think, this August. Really meant to highlight the issues around lead in private wells or in private homes. It's not typically a well issue. It's a pipe plumbing, premise plumbing issue, but understanding your water quality is certainly a component of whether you might be leaching lead or not. So we have a webinar. We recorded it. We also created a page with a lot of information for well owners so they could go read more about it. EPA's done some work where they've shown that some of the filters that are available for a kitchen tap are great at taking out arsenic or at taking out lead, well above what they're been tested for, like from UL. 500 over 1,000 in some cases. So we try to put as much information out there for well owners that they can use, and that's available here. We've created a bunch of short videos, things that you might not even consider and probably aren't as lab appropriate, but if you have a shared well and you're a well owner, do you have an agreement with a person whose property the well is actually on? There's a lot of issues where a house gets sold, the well's there, there's no agreement, it was a handshake before, now all of a sudden the other well owner other homeowner finds out that they're no longer going to have access to that well. I mean, there's just a lot of issues like that we deal with. How does my pressure tank work? How does my well work? There's 16 of those videos that are available, and they're all 3 to 5 minutes long. We have a podcast if you're into that sort of thing on the first 3 lessons, and also some interviews we did with the Rural Farm Bureau Radio Network in Illinois about abandoned wells and some other issues. And we also have more for professionals. NEHA, the National Environmental Health Association, has put our class on their e-learning website. So if you're a sanitarian with NEHA credentials or with ASHI for home inspectors, you can go through that class for free, take the quiz after each lesson, and get credit for it, CE credit for it. RCAP staff, who are our partners, are putting on workshops around the country, in-person workshops where they bring in experts, and they're also doing these assessments, which I'm not going to talk about today, where they can work one-on-one with the well owner. And so that's all on our partners page. This is our partners page. You can sign up here. We put out a newsletter that goes out once a month. Up here at the top is the newsletter archive. We've created this brochure, which I'll talk about here in a second, that's available. This is our newsletter. This is a video that we created on how to abandon an old dug well. Every issue comes out once a month again, has information about what other people are doing around the country, events that are coming up, ideas for how to supplement your program, and again, it's all free. So it's been mentioned twice today about the private well conference we held last year in May. Sarah brought it up. She gave a talk there. and I brought up Barb Lukonen. We had her talk as well. We recorded the entire conference. There are 28 presentations. They're all on private well issues. Dan also spoke there and talked about our lab. You can go to our website and find all those presentations under webinar and events. If you there'll be a drop down that says a private well conference, and it was just about private wells, and we brought in a bunch of experts. We actually paid for over half the speakers' way to get them here because we had an agenda on what we wanted to cover. So all of these talks are relevant to private wells. I encourage you to go look at the website. There's actually 39 talks there. There are also 14 lightning talks, or 12 lightning talks, 5-minute talks. And I do want to mention that we're planning the second conference for May of 2019. We don't have a location yet. We will in a month or so. It's going to be out east somewhere. So it's very worthwhile. Everyone that attended, we had people from 32 states there, and they all plan to come back. So this brochure, we developed this to hand out to like health departments and labs. So we sent out an email, and NEHA did as well on our behalf. Would you like copies of this to hand out to your well owners? There's a place here right underneath the private well class where you can put your own label, so you can put your own contact information. And we ended up giving out 24,000 of these just a few months ago. And we're probably going to do another printing this fall. You can see it on our website, but it's really just about is your well water safe? It's a trifold. We get them printed, we ship them to you. It's all completely free. And again, that's because of the grant we have. And so this is the inside, what you need to do, why you need to test. Here's some best practices, and here's why you really need to take the private well class. And sure, it does toot our own horn, but it's been vetted. It's been around since 2012, and it's really a useful tool to help well owners understand their wells. We have everything in Spanish as well, if you're interested in an area that has a lot of Spanish-speaking well owners. And I didn't show it, but we also have a complete Spanish version of our class. So you can take the entire class in Spanish if you want to. I do want to make a point, and I may have mentioned this, but our site is down. And I've worked at the U of I for 30 years, and our site has only been down twice since it started. And we have a server issue, and one of our students got some malware on his laptop and brought it here and hooked it up, and their U of I security folks are fixing it, and they hope to have it done by the end of the day. But all the resources I just showed you right now, you can't see. I'd wait a day or two, and then it should be available. So since we're so far over time, I'm going to, and I appreciate those that have stayed, I'm going to pull up the questions we have for today. And the first one is really for Dan. Because I figured Dan's also a private well owner, which makes things very handy as the manager of our lab and understanding what the issues are. So clients often ask us if, based on their results, they should install a water softener. So Dan, what goes into making that decision? Is it just hardness, or is there anything else?
Hardness is a big thing, Steve. Iron is probably may even be bigger than hardness, although if iron were the only concern, they could just put in an iron filter. A lot around here in Illinois, water is, a lot of it's pretty hard, so most people will put in a softener, but it's kind of a personal preference. So if you don't have a problem with the hard water spots or iron staining, then you may not want to put in a softener. Be aware that they do add sodium. Steve showed a slide earlier that had a pretty good example. It adds a couple hundred parts per million around here, at least. It depends on the amount of calcium and magnesium in the water. Generally speaking, if you know your hardness in parts per million, you cut it in half, and that's about how much sodium you're going to get. So if you have 400 parts per million of hardness, you're going to add about 200 parts per million of sodium. You could base it on if you consider the water soft or hard. There's Water Quality Association, US GS, and others. Generally, on average, I would say less than 50 parts per million is considered soft, and people probably don't have to worry about a softener. But it really depends if you're getting annoying stains or iron staining or hard water deposits.
You could also put in a potassium chloride softener, right?
Yeah, if there are concerns with sodium, you can put a potassium in for your salt instead of sodium. I think I haven't checked prices recently, but it seems like potassium chloride used to be about 4 times. So whereas a bag of sodium chloride will cost you like $5, potassium chloride probably cost $20, and it will increase potassium, similar to sodium. So that's something to be aware of.
Thank you. So this next question, the new head of the EPA wants to, or is now deregulating a lot of safe drinking water policies. So I work in the water industry, both with community water supplies and private wells, and on a national level. I'm not aware of deregulating a lot of safe drinking water policies. And so whoever put this in, I'd like to know what specifically what you're talking about, because I know, I'm not a fan, I admit, but as well. But I'm not sure what those policies, actually Congress has made it clear that they, in the way they funded things, even if the president has taken it out of his budget, the Congress has put it back in for a lot of the programs that support drinking water. And so it's one of the areas where not a lot of things have changed as far as safe drinking water. Some of the research money has gone away. But not the money that goes for outreach and technical assistance for like well owners and communities. So if you'd email us, I'd love to have a discussion with you about that. But as far as the other part of this really isn't for me to answer. Will this affect the health department lab testing overhead costs for testing MCLs, AS nitrates? I mean, they're not going to get rid of the arsenic standard or the nitrate standard. Those MCLs are set by Congress and passed into law through the Safe Drinking Water Act. So I don't think states control well contractors. And so I don't see any states changing the regulations to lower any standards. It's more likely that construction standards would get stricter as the states move forward, like, laws seem to build on themselves. So does anyone have anything they'd like to add to that, or have I answered that well enough?
That sounds good, Steve.
All right, thanks. And again, please email me. I'm always trying to learn more about what's going on, and if I'm missing something, I'd like to know. Do you have recommendations on what tests should be performed on well water after fire retardant is used for a forest fire? This is an ag lab. Yeah. It's been shown the PFAs, polyfluorinated, I can't even tell you what they are, is a big buzzword right now, and they're certainly finding more and more of it. States are starting to write their own regs because there is no EPA requirement under the Safe Drinking Water Act. I just read an article last week about a home in a small town, I might have mentioned already today actually, where the wells near that home where there had been a fire are now starting to show PFAs in the water. So certainly for fire retardants, that's the problem. What people don't realize is even if you're near an airport, I also had a question from someone near an airport in Ohio, and they're like, well, there have been no fires there in like 10 years or 20 years. They checked, but all the fire department folks practice. And I read an interview with the head of a airport fire department who said that they order over 1,500 pounds of that fire retardant every year just to practice and be prepared for when there is a fire. So, PFAs, I'd say, that's the only thing I know of related to fire retardants that's really an issue. Yeah. Does anybody have any other thoughts there? I will hush for a second and see that what's going on. Okay.
Sorry, Steve, this is Sarah. I would, so the per and polyfluoroalkyl substances, so EPA method 537 is validated for drinking water, so that might be a possibility. And if the ag lab wants to get in touch with me, I can put you in touch with other labs who might have done similar testing.
Great, thank you.
Mm-hmm.
So number 4, I haven't seen a lab that advertises including glyphosate in their pesticide scan. This is overused and abused everywhere and probably a carcinogen. Why is it not routinely tested? Water quality and quantity testing is also very important for property transfer. So while Sarah and Lou were talking, I looked up glyphosate and found a paper from 2017 from the Journal of Well, it's the Journal of Environmental Research and Public Health, and it says right here, despite the fact that glyphosate is considered a non-toxic pesticide to humans, that's one thing. The other thing I found was this from the Department of Pesticide Regulation in California, and they also talk about LD50 doses, and that when you read this, you can find this online. It doesn't appear to be, there's no definite proof that it's a carcinogen, at least at this point. And so I'm sure that doesn't satisfy you for an answer, but that's probably why labs don't test for it, because it is very common, it's very soluble. It just doesn't, all the testing and the EPA's done, state of California's done, doesn't show that it's necessarily a health risk, or as much of a health risk as a lot of other things. So, and if you have other information, again, our email address is info@privatewellclass.org, and I would love to see it. Yeah. I'm going to move this down so that I can show it easier. Anybody else have a thought on I'm not a chemist, I freely admit that, so does anybody else have anything to say on glyphosate?
So Steve, this is Lou. So glyphosate is regulated under the Safe Drinking Water Act. So public health labs that are principal laboratories for their state should be able to test for it. I agree. I mean, it's not something that we routinely recommend that private well owners test for it. Although we do get questions about the fact that some people do call up and say, well, my neighbor uses a lot of this stuff. Should we test our well? And it's sort of a case-by-case basis. One of the deterrents, though, is some of these analyses that involve, pesticide, herbicide testing tend to be the more costly test, as opposed to doing a bacteria or a nitrate or fluoride. So we handle those on a case-by-case basis, really. We don't promote it, but if people really want to do it, we'll do it for them.
Great, thank you. So can a private lab that doesn't have staff to answer well owner questions refer them to their state lab for advice? And I assume that gets to Lou. You talked a lot about a lot of the services you offer as a state lab when well owners call, and the connections you've made in partnerships. I can see where that would be tougher for a private lab.
Yeah.
To develop all those sorts of resources. So, is that, if there's a private lab in New Hampshire and they wanted to refer folks to you guys, I assume you would welcome that.
Yeah, we do. We get those calls all the time. I mean, we get calls from private well owners that have their water tested at private labs, and then when they call the private lab to get information about their results, the private lab will refer them to us for help in interpreting the data, or interpreting the report results, or helping them understand the report, or helping the well owner deal with treatment options and things like that. So I from my perspective, and I assume it's true for all public health laboratories, I mean, again, that's what we're here for. So I think, in my opinion, I think if you're a private lab and you can't answer questions related to private well testing, that I don't see why you couldn't refer the person to the state lab for answers.
Yeah, seems logical. All right, and the last question we have is, for your statewide surveillance survey, is the pH test done in the field or in the lab?
I think that's for me. So the pH test would be done in the lab. I know pH is one of those tests that technically is supposed to be done immediately, but we're not planning on doing that in the field.
Yeah, I think that's rare. I mean, most of the time you collect a sample, you don't have any equipment with you. So,
right.
Yeah.
So,
all right.
I mean, it's not guaranteed, but typically, we'll do pH within the first 24 hours.
Okay. Well, I appreciate the 57 of you who have stayed the entire time. And again, this is recorded. Feel free to, it should be online on our website, assuming it's back up by the end of the week or maybe next Monday. And so I want to say thanks to Sarah and Lou, Dan and Katie for all your help today and for participating. And if you have any questions for me or for any of those folks, you can email us at info@privatewellclass.org and we will get them the message. So thanks for attending. And with that, I think we're going to close the webinar. I apologize that it went so long, but I certainly think it was worthwhile. So, all right, everyone have a good day. Thanks, you guys.
Thanks, Steve.
Thank you, Steve, and everyone.